significance of what we just watched? Talk about that a little bit.
Well, I think a couple of things. First of all, it's significant for the patient, the personal side of this. That you have a patient who has had coronary disease for many, many years, who suffered from that. And as you saw through that procedure, there were some amazing things taking place where that blood flow was actually much, much better than when it began. So hopefully this patient will not have any additional issues regarding blood flow to their lower extremities, which could, as you saw, could lose a limb or lose a toe, something like that. So it really is life-changing for the patient. And then you think about that and how it connects to all these physicians around the world that are watching this procedure, which is cutting edge and only being done here in Kingsport today. And you think about how you can apply that across many, many other patients in the future. So it really is impacting a personal life here locally, but it's also impacting patients all around the world by being able to understand this technology and apply it to their own patients.
It sounded like this is a fairly common, the circumstances of the patient were fairly common for this region.
It is. I mean, you think about some of the complications. The patient was diabetic. They had they smoked and maybe were not compliant with what they were supposed to be doing to stay healthy. And as you know, we have issues in our region with diabetes, with smoking, with heart disease, and so it really kind of it's close to home with the people we care for in our region here. So I do think it is pretty common for a lot of people in our region. Unfortunately, they suffer from that. And so this is just a way for us to bring the technology that's worldwide technology, as I said earlier, very cutting edge technology to the Appalachian Highlands region.
What all goes into setting up a live procedure like this?
Many, many people working a lot of hours, the coordination between the conferences and the conference itself in Germany and our folks here on the ground. Dr. Metzger picking a patient for that, getting the patient to agree to be a part of that is really important. Putting the panel of experts together and you saw how they converse with each other, which was pretty amazing, how you could, during a case, converse with each other with experts around the world. So there's a lot of coordination that takes place, not only locally here, but worldwide, and with the Germany conferences to make this work. So a lot of work, a lot of hours, amazing nurses, technicians inside the cath lab that prepare for this, and of course Dr. Metzger and his other team, physician members that are part of that, really working to bring this all together today.
And then for clarification, what was the process of getting this hospital and this patient and doctor chosen for this live procedure?
We do a lot of work with stent manufacturers around the world, and so and the procedures that we use, the equipment that we use, the technology, we were chosen to do that here because Dr. Metzger's expertise, the expertise of the cath lab here locally, of the folks that work there is better. There's no one else better in the world that does this than right here in Kingsport, so it's pretty amazing we get to do that. So we oftentimes work with stent manufacturers to do clinical trials here, and so we were chosen because of the expertise and the success we've had to continue to do what we did today, and so we were chosen because of that expertise.
Two quick questions. One, is it difficult to find folks who are willing to be the patient in this situation? And two, are these kind of stent procedures becoming more and more done with the patient awake?
Typically, so the first question, I think it depends obviously on the patient, but I think to provide the relief that the patient's looking for, and this is almost really the last resort for this patient to have the relief and to have the blood flow that they need to preserve the limbs. So I think that's going to be really patient by patient on whether they feel comfortable being part of a live stream. As you can see, you couldn't really see any part of the patient at all, and you couldn't hear them or anything. But the patient typically, in cath lab situations, the patient is typically awake during those procedures. Sometimes they'll get a mild sedative just to put them more at ease, something like that. But most, all the cath lab procedures that I know of are typically the patient is awake during that process.